tuned to Evergreen Media Network. I am Cindy Schwartz. This is the Patient Partner Show. We are also a podcast on Spreaker, so look us up on that. Jeannie Roller is my co-host. Jeannie Roller, we're going to answer a little bit of a question from a podcast we did not too long ago, and it was about the Never event. So you wanted to follow up a little bit with that, and then we'll go on to the topic, which today is about the percentage now in 2024 of males becoming RNs. So let's first start with the Never events. You wanted to talk about some insurance and about Medicare and Medicaid being the gatekeepers for that. So if these Never events happen, and Medicare and Medicaid are saying, and now insurance companies are saying that we're not going to pay for these Never events, who actually pays for them?
Exactly. I mean, because you remember, Cindy, and I remember that when you go into the hospital, you sign a form saying that whatever is not paid for by Medicare, Medicaid, or your insurance company, that you are responsible.
Mm-hmm.
So I would like to know who actually gets stuck with that bill
when that happens. Yeah,
I would also like,
mm-hmm.
Yeah, it just, to me, somebody is paying for it. Who? In my opinion, too, I think that some of these Never events, because they know this is happening, they aren't forthright in their medical records, I believe, in reporting them. Like with my husband, there was no consent, but they buried it and they didn't make a big deal. We had to discover that. So, I mean, to me, that's very interesting. And I would like to find out the answer to that question of who actually pays for these Never events.
You know what? So my thought on it real quick is, and this is going to sound horrible, but I'm going to say it anyway. At the end of the day, the patient pays both literally and figuratively, because if these Never events are happening to the patient, I mean, physically, the patient's going to be paying for it. And then monetarily, I would think the same thing, too. It's really sad. It's just, when are we going to get to the bottom of this? Are we ever going to get to the bottom of this on how healthcare is more transparent, and also how it is, I don't know, I don't want to say taken more seriously, because that sounds bad for the people that certainly are. I mean, there's thousands and thousands and thousands of people in the medical system that are just phenomenal people doing excellent work and all of that. It's a shame that some of this other stuff is going on and that we don't seem to be getting a handle on it. On that note, let's talk to the percentage of men that are becoming RNs in the medical arena, which is a good thing in a lot of ways. I mean, kudos.
Mm-hmm. Right. It says in the article I was reading that the number of male RNs have tripled since the early 2000s.
Wow.
A lot of men are now becoming nurses because of the job security, stability of the job.
Mm-hmm.
It was usually known as a pink collar profession,
right?
Because it was primarily women. For years and years, it had been hovering around like 94% female. So a lot of the men have come from being paramedics, firefighters,
mm-hmm.
military.
Mm-hmm.
So in reference to what we talked to, this is a kind of a double-edged sword, that if there are more male RNs, that's good in one way for male patients, but for female patients, it's bad. So, we've talked about this before, Cindy, that why can't they assign? Because in ORs, in most ORs, except ER, they know who's coming. So why don't they assign men to men and women to women?
Well, so especially for intimate procedures.
Right.
Intimate procedures is really that's what we generally talk about. That should be the discerning factor. Unless a person and unless a person is asked and the person agrees to it, it doesn't matter to them. But for the people it does matter to, the question needs to be asked for an intimate procedure. And we've had the argument from the facilities, many of the facilities, that we don't have enough staff to go around. And to me, in my opinion, that's just, it's just lip service. Because like you say, you know who's coming in. And what is the problem with somebody saying, I don't want to have a male nurse for my GYN procedure. Or
But the truth,
guy saying, I don't want a female nurse necessarily for my procedure.
but the truth of the matter is, many procedures require intimate exposure because they like to strip their patients naked for prep.
Well, that's
So
right. Yeah.
most patients. So even if you're not getting a GYN or a prostate operation procedure, you will probably be stripped naked for the prep and then the post prep afterwards, the cleanup. So that was kind of my point is,
Okay.
why do they not assign men for men and female for female, and why are they not asking? Because it sounds like there are more and more male RNs to go around. So why don't they take this into consideration more?
I can also hear the facility saying that we don't strip our patients naked, that we don't do this and that. Everyone's covered by a blanket. But you and I both know, I know from experience on the surgeries that I've had, that is not true. The patient is completely stripped naked, and there isn't blankets and covers on all of that. We've been there. And a lot of people don't know it's happening because they've already been pre-medicated to go into these different surgeries and stuff. And that's disturbing, too, in a lot of ways, too, because if you know that that's happening and you don't know what really is going to happen to you in that instance, it's a horrible feeling. It really is. But you're totally violated.
Right.
You are. And it is very traumatizing. And, it just is. It is. And I'm so sorry for the people that it's happened to. We've had so many on this podcast, and we've had so many that talk with us that don't want to come on the podcast.
Right. Well, Cindy, and it's true, you are covered up or draped during the procedure. But what I'm talking about is before it happens, you are laying there naked.
And after
procedure,
yeah.
Afterwards, you will be again, too, because they will uncover you and clean you up and then put the gown back on. So, yes, there is a period of time when most people will be naked laying there.
Mm-hmm. So, and we've talked about one surgeries, too, is that we can't. Again, we're not medical people. We're not lawyers, any of that. But we've talked with people on this podcast that have gone in for foot surgery and they're totally naked. And we're trying to figure out what that's about. I mean, I've asked facilities, I've asked doctors, and most of the reply is we don't do that to our patients, but yet we have patients that have come on and said that it's happened. And it's happened in, how many states have we? 17, 20, 35, 50 states, all 50 states, and worldwide. So somebody is doing it, and we've seen it in action, and we've talked with people in action, and it's not that we're prudes or we're whatever. The other thing that we've said so many times, too, is that your body temperature then is totally fluctuated because you've got all these medications in you, and now you're in a room that's cold. It's totally cold. So I applaud the male RNs that are going into this profession. Unbelievably, it's a tough, tough, tough job. We say it so many times that there is so many people that are doing fabulous medical care in so many facilities that are excellent. And it is a shame that there has to even be the conversation that there are facilities and that there are workers that are not. And we as the patient don't know who those are until it happens to us. And then we can't say anything about it because we can't say anything about it legally. I can't tell you it happened at blah, blah, blah facility in Eastern Massachusetts or whatever. I'm just using that for example. And I can't say that these were the people that have done it to us. I've seen it happen or whatever. These are the doctors. So our hands right now are tied, so we just keep talking to all the people that we have in this whole group of ours, and it's thousands of them, which sadly is true. Tens of thousands of them. Sad that we have to have this conversation, but it is a good note that RNs are now, there's a lot more male RNs for procedures that need to have male RNs in the procedures. Thank you for becoming a nurse, for our benefit. On that note, stay listening to Evergreen Media Network.